That the nurse is calculating the intake and output for a client in the intensive care unit. The client's chart noted the following information. The client drank 6 ounces of milk with cereal at breakfast. They drank 1 cup of coffee and voided 300 mLs at 10 o'clock. The client voided 500 mLs at 11. At lunch, the client ate a turkey sandwich and drank 1 cup of orange juice and voided 300 mLs. The client ate a chef salad at dinner with 8 ounces of iced tea and voided 400 mLs. The client has a continuous infusion of 0.9 normal saline running at 125 mLs per hour for 12 hours. What amount will the nurse document for the client intake and output for the shift? So, first, let's calculate the intake. So we're going to go back through the scenario and we're going to highlight everything that is considered intake. So first, we're going to highlight 6 ounces of milk. All right, and then we're going to do 1 cup of coffee. And then we're going to do 1 cup of orange juice. And then we're going to do 8 ounces of iced tea. And then we're going to do 125 mLs per hour for 12 hours. All right, so let's calculate the input first. So let's take the 6 ounces. So we know that our intake has to be in mLs. So 6 ounces, we're going to multiply that by 30 because there are 30 mLs in 1 ounce. All right, so we multiply that, we're going to get 180 mLs. Next, we know that 1 cup is equal to 240 mLs. Next, the client also had another cup of orange juice, so we would do the same. 1 cup is 240 mLs. So then the client had 8 ounces of iced tea, so 8 ounces, and we know that there are 30 mLs in an ounce, so we have to convert that over, and we get 240 mLs. And then last, we have that the patient is getting 125 mLs per hour for 12 hours. So it's going at 125 mLs, and we're going to times that by 12 hours. And we're going to get 1,500 mLs. All right, so all we got to do now is add all these up together, and we should get 2,400 mLs. All right. So now, let's go back to the problem and highlight the output. So the patient voided 300 mLs, they voided 500 mLs, and they voided 300 here, and they voided 400 here. So all we have to do over here is just add all these up together. So 300 mLs, 500 mLs, 300 mLs, and 400 mLs, and you add all that up together and you would get 1,500 mLs as our patient output, and our patient intake is going to be 2,400. This problem says the client had the following intake during the shift. So they had 6 ounces of coffee, they had 50 mLs per hour, and if you look on the side, it gives you a time frame. So it just says from 7 o'clock to 8 o'clock, so that's only 1 hour. And then at 8 o'clock, they had 9 ounces of apple juice. They also had 9 ounces of bran flake cereals with 1 half cup of milk. And then they had 2 packs of red blood cells, which are 250 a piece. And then they had a can of ginger ale, which is 12 ounces. So let's calculate this patient's intake. So we're going to highlight all that's considered intake. So we got 6 ounces of coffee, we got the 50 mLs per hour, then we got the 9 ounces of apple juice. Now, we're only going to count the half a cup of milk because cereal is not considered intake. All right, so then we have your 2 packs of red blood cells, which are 250 a piece, and then we have 12 ounces of ginger ale. So 6 ounces times it by the 30 mLs, that's going to give us 180 mLs. So then this only ran for 1 hour, so your infusion only ran for 1 hour. So we're only going to do 50 times 1, which is 50. Then we have 9 ounces, so we're going to take 9 ounces and then we're going to convert it to mLs. So we have to multiply by 30, and then we get 270 mLs. So then we have a half a cup of milk. So 1 cup of milk is 240, so half of that is going to give us 120. And then we have 2 packs of red blood cells. So they are 250 a piece. So we're going to times 2 by 250. And we're going to get 500 mLs. And then we have 12 ounces. We're going to convert that to mLs. And then we get 360 mLs. So we're going to add all that up together. And we should get 1,480 mLs. That is the input for this client. All right, so for this problem, we will be calculating the intake and output, but we will be highlighting as we go. So let's start with the intake. So at 8 o'clock, this patient had 2 pieces of toast, 2 cups of oatmeal, 8 ounces of yogurt, 12 ounces of orange juice, and 2 ounces of grits. So the only intake we're going to count in this is going to be our 12 ounces of orange juice. All right, at 10 o'clock, they had 2 8 ounces of coffee with 2 ounces of cream in each. So we're going to highlight the coffee and the cream. All right, so then at 11, they had 24 ounces of ice chips. We're going to highlight that. And then at 12 o'clock, they had an IV infusion of Zosyn, 50 mLs. We're going to highlight that. They had 2 mLs of IV push Zofran. We're going to highlight that. And they also had a 10 cc, which is also mLs, of a saline IV flush, and we're going to highlight that. At 12:30, they had a house salad, 12 ounces of soda, and 3 12-ounce popsicles. So we're going to highlight 12-ounce soda and 3 12-ounce popsicles. At 1400, they had a pack of red blood cells, which is 250 mLs. At 1500, they had 2 ml morphine, and they had 10 cc's of saline flush. At 1750, they had 10 cc's of saline flush, so we're going to highlight that. And then at 1600 to 1900, they had 100 cc an hour normal saline infusion going on. So remember that cc's is the same as mLs. So we now have all of our intake highlighted. So now let's convert them over. So we got 12 ounces of orange juice. So we know that we have to convert that to mLs. So that's going to be 360 mLs. So next we have 2 8 ounces of coffee with 2 ounces of cream in each. Now you want to make sure that this one doesn't trip you up, because there is 2 cups of coffee, and you also are going to put 2 ounces of creamer in each. So we're going to do the coffee first. So 2 8 ounces. So we know 2 8 ounces, that's going to give us 16 ounces. So 16 ounces times 30, and we're going to get 480 mLs. So let's not forget about the creamer. So we have 2 ounces of creamer in both. So that's a total of 4 ounces of creamer. So we're going to do 4 times 30. And that's going to give us 120. All right. Next, we have 24 ounces of ice chips. So remember, with ice chips, we use half the volume. So we're going to do 12 ounces of ice chips. And we're going to times that by 30. And we're going to get 360. So then we want to include our Zosyn, which is 50, and that's an antibiotic. And then we're going to give our 2 mLs for our nausea medicine, which is Zofran. And then we have our flush, which is 10 mLs. All right, and then your patient has a 12-ounce soda. So we're going to convert 12 ounces to mLs. So we have 360 there. And then your patient has 3 12-ounce popsicles. So we want to take 12 ounces, times that by 3, and then we'll get 36. So we have a total of 36 ounces, and we're going to convert that to mLs. So we're going to get 1,080 mLs. All right, so next we have the packed blood cells, so that's 250 mLs. And then we have 2 mLs of morphine, 10 mLs of flush. So remember, cc and mLs is the same thing. We have another 10 cc flush. All right, and then from 1600 to 1900, which is 3 hours, the patient had a IV infusion of normal saline going at 100. So we're going to take 100 times 3, and we're going to get 300. All right, so we're going to add all these mLs up together, and we should get 3,394 mLs. So this is considered the patient's intake. All right, so the problem also wants us to calculate the patient's output. So let's go back to the problem and see, do we see any output? So we see at 11 o'clock they had 500 mLs of urine. So we're going to write down 500 on this side. And then they also had at from 1600 to 1900 they had 1,000 mLs of urine. So we're just going to add 1,000 to 500, and we're going to get 1,500 mLs, and that's going to be our output. So our intake is 3,394 mLs, and our output is 1,500 mLs. So the question says, a nurse is reviewing the 24-hour intake and output for a patient. In the past 24 hours, the patient has consumed 10 ounces of water, 8 ounces of juice, 12 ounces of clear liquid soup. The patient has been on IV fluids, normal saline, going at 100 mLs per hour for 8 hours. Furthermore, the patient has 150 mLs of drainage from a JP drain and has voided 3 times, which the first time was 200, second time 400 mLs, and the third time 250. What is the patient's fluid balance? So in order to get the fluid balance, we need to calculate the patient's intake and the patient's output. All right, so we're going to go ahead and highlight the patient's intake. So they had 10 ounces of water. So we're going to do 10 ounces, and we know we have to convert to mLs. So that's going to give us 300 mLs. And then we have 8 ounces of juice. And we're going to convert that 8 ounces to mLs as well. And you're going to get 240 mLs. And then the patient has 12 ounces of clear broth soup. So that's going to be 12 ounces times 30. And that's going to give us 360 mLs. And then the last intake we have is the normal saline going at 100 for 8 hours. So we're going to take 100 mLs and we're going to times that by 8 hours, and we're going to get 800 mLs. So we're going to add all that up together, and you should get 1,700 mLs. So this is the patient's intake. So for the patient's output, they had a JP drain of 150. They had 200 mLs of urine, 400 mLs of urine, and 250. So we're going to do 150 mLs, and then we're going to do 200 mLs, 400 mLs, and 250 mLs. We're going to add that up together, and we're going to get 1,000 mLs. And this is going to be considered our output. Now, in order to get the fluid balance, we're going to subtract the intake from the output. So we're going to do 1,700 minus 1,000, and we're going to get 700. So we're going to get a plus 700 mLs. So what does this mean? This means that the patient took in more than they let out. So what could be some reasons for that? If your patient was super dehydrated, this is expected, but also if your patient had like heart failure or they had kidney problems. All right, so these are the examples. So you just want to make sure that you are converting over. So I hope that this video will help you guys understand